afternoon, everyone. Thanks for joining us today. Welcome to the 8th Annual Celebrate Research event. I'm Adam Wurdenberg.
And I'm Laura Garrick. Adam and I will be your hosts for today's virtual event. Every year, this event brings us together to recognize the achievements of the research community at St. Joseph's Healthcare Hamilton and to celebrate the recipients of the Research Institute Awards program.
Last year, we held our first virtual Celebrate Research event. As the pandemic continues, we've decided to stick to this format until we can be together again safely. And with the great level of digital engagement we saw last year, we'll be looking at ways of integrating the digital experience into future in-person events.
Whether in-person or virtual, Celebrate Research provides a platform for us to showcase innovative research projects being conducted here at St. Joe's. Our main goal today is to celebrate the recipients of the 2021 Research Institute Awards program, which recognizes talented researchers, committed students, and caring health professionals who are all demonstrating excellence in their fields. With generous support from the St. Joseph's Healthcare Foundation, our awards program is investing in novel research. By funding both novice and seasoned researchers, we are helping to expand their work with exciting leading-edge studies.
Through a peer review process, the Award Review Committee determines the top candidates for each award category. We'd like to offer our sincere thanks to the members of our Award Review Committee for volunteering their time to review each application. And we can't thank our donors enough for their tremendous support. Without them, it would not be possible for St. Joe's to run such a diverse research program.
Now, before we kick off our awards, remember, if you're watching this via the live premiere on YouTube, engage in the live stream comments and show your support for your colleagues. You can use the hashtag CelebrateResearch2021 on Twitter to engage with our research community there as well. Be sure to follow the Research Institute on our social channels, Twitter and Instagram. Search Research St. Joe's and you'll find us.
With that, let's check in with our good friend Dr. Joe Pellizzari to present the Professional Advisory Committee's awards.
Good afternoon. I'm Dr. Joe Pellizzari. Once again, I have the honor of representing the PAC Research Subcommittee to announce the recipients of the 2021 Interprofessional Research Awards. There are two award categories. The first is granted to a novice researcher, and the second is granted to an experienced researcher. The recipient of the 2021 award in our novice category is Stephanie Piatek. Acute respiratory distress syndrome is, unfortunately, one of the cardinal features of COVID-19 in hospitalized patients. If this occurs, the first-line therapy for ventilated or intubated patients is proning, that is, turning the patient face down. However, proning can cause pressure injuries to the nose, cheeks, and face due to prolonged immobility. Stephanie and her team will study strategies to reduce pressure ulcers in critically ill intubated patients. Congratulations, Stephanie.
Thank you to the Research Institute at St. Joe's Hamilton for funding the Professional Advisory Committee Interprofessional Research Award. It is an honor to have been selected this year. Supporting my research project entitled Optimizing Prone Positioning in Critically Ill COVID Patients to prevent facial pressure injuries will help reduce adverse events for patients that are positioned face down during treatment in the ICU. As an occupational therapist, I look forward to considering what can be improved as we develop an evidence-based prone positioning protocol to reduce injury complications due to facial, skin, and pressure damage from medical devices and minimize healthcare costs and the longer impact of this trauma. I'd like to extend a thank you to my colleagues for your time and assistance to collaborate, including Kelly Hassel, Respiratory Therapy, Cindy Orlicki, Nursing, and Dr. Michelle Coe, Physiotherapy. I am interested in the multidisciplinary collaboration and quality improvement initiative that can be formalized as a result of this opportunity. Thank you.
Now on to our experienced researcher category. I'm happy to announce the 2021 award recipient is Dr. Taylor Hatchard. The heightened vulnerability and mental health disparities among transgender and gender diverse youth are well documented. Dr. Hatchard and his team will pilot the efficacy and treatment acceptability of the Transcending Barriers CBT group intervention. Ultimately, the hope is that this program will significantly reduce the impact of stressors and positively impact the mental well-being of trans and gender-diverse youth. Congratulations, Taylor. On behalf of the Professional Advisory Committee, I wish you both the best of luck in your research endeavors.
Hi, I'm Dr. Taylor Hatchard. I would just like to thank the Professional Advisory Committee as well as the many generous donors that make this award possible on behalf of myself and our whole research team. Thank you to each and every one of you for supporting our work. Our research program is aimed at reducing the mental health disparities of trans and gender diverse youth. And so we're going to be using this award to test out the feasibility and proof of concept of a minority stress-informed cognitive behavioral therapy intervention called Transcending Barriers. The goal of this intervention is to address the core impact of minority stress experiences, which are experiences like rejection, victimization, discrimination, and so on that occur chronically for many trans youth and contribute to the formation of things like mood and anxiety concerns and even suicidality. And so we're hoping that this is a step towards improving the mental health trajectories of trans youth who are really vulnerable and really need more mental health support. And so I just want to thank each and every one of you for supporting our work. Thank you.
Thank you, Dr. Pelizzari and the PAC Research Subcommittee, and congratulations again to our winners. Did you know that St. Joe's is home to over 200 researchers and over 700 research staff and students? Whether it's clinical, translational, evaluative, or fundamental research, St. Joe's scientists are working to improve diagnostics, care, and treatment for patients. They're conducting research that changes lives. To learn more about the Research Institute and to see some of the most impactful research stories over the last year, be sure to visit stjoes.ca/report after today's ceremony.
Next is a very special award selected by committee after an open call for nominations. This award recognizes those who bring excellence to the workplace through outstanding service, who foster innovation, who take initiative, and who create a positive influence and rapport in the workplace. That's right, it's time for the Research Institute's 2021 Staff Recognition Award.
This award recognizes a research staff member who consistently makes a positive contribution to the research success of their department. We're lucky to have so many shining examples of staff who embody these values, and we owe much of our success to their contributions.
This year, the committee has selected not one, but two equally deserving candidates to receive this award. In no specific order, I'm pleased to announce that the first of two recipients of the 2021 Staff Recognition Award is Sarah Culgan. Sarah is a valued member of the Critical Care Research Team. As a research coordinator, Sarah is regarded as an excellent source of support and advice for junior coordinators and medical trainees working on research projects. During the pandemic, she spent countless evening and weekend hours assisting with applications for COVID-19 funding, helping to launch new research projects during a time of such uncertainty. She showed great poise and compassion when recruiting critically ill patients to join pandemic studies, when even their own family members couldn't visit them. Apart from her work in critical care, Sarah has been working with St. Joe's Digital Solutions team to enhance academic productivity, helping the team secure grants to study artificial intelligence with alternate level of care patients. Sarah has enthusiastically embraced digital transformation of research and knowledge translation, bringing together groups of clinical guideline developers, health informaticians, and software designers to work collaboratively. Their goal is to bridge the gap between frontline healthcare workers using modern health information systems and clinical practice guideline developers looking to get their guidelines in use at the point of care. Sarah is a true ambassador for the Research Institute, championing St. Joe's research at many public fundraising events. She is described as a dedicated colleague, a gifted administrator, always willing to lend a hand, and empathetic towards all patients and families she engages with. Congratulations on this well-deserved award, Sarah.
Hi, I'm Sarah Culgan, Research Manager for the Guide Group here at the Research Institute of St. Joe's. I'm very grateful to be a recipient of the Staff Award this year, particularly as many of my colleagues are equally deserving. I'm also grateful to have been nominated, especially by those who chose to do so, as they are the ones who inspire me to show up every day and try to do my small part to help improve patient outcomes for our critical care patients here at St. Joe's and around the world. So thank you so much for this nomination. I'm very honored, and I hope that I can continue to live the mission, vision, and values of St. Joe's and the Research Institute. Thank you.
Thank you, Laura, and congratulations, Sarah. Now it's my honor to announce the second recipient of the 2021 Staff Recognition Award. Congratulations, Norm Conyer. Norm has been at St. Joe's for over 17 years. He works in St. Joe's Imaging Research Center, the IRC, which offers state-of-the-art imaging capabilities to researchers across Hamilton. By all accounts, the Imaging Research Center could not function without Norm, who's been invaluable in all aspects of the day-to-day activities, administrative duties, training students, giving lectures on safety, building hardware for IRC users, writing software, regulatory duties, and much more. But Norm's contributions go well beyond that. For instance, he managed to set up and maintain the new hyperpolarized xenon MRI lung program, which is being used by Firestone researchers to pinpoint problematic areas of the lungs. He also teaches IRC students who come from diverse backgrounds, including engineering, physics, psychology, respirology, and more. A fantastic lecturer, Norm trains these students in hardware design, image analysis, computational work, and programming. Norm's dedication to St. Joe's is well known by the many chiefs of staff who have sent letters of gratitude to the IRC. He provides support to the diagnostic imaging department, which is beyond his job description. He's always willing to provide physics support to this clinical unit to help keep things running smoothly. Norm frequently greets research participants who are undergoing a scan in the IRC, and he's always courteous, helpful, and reassuring. He'll also help patients in a hospital for a PET CT or clinical MRI find where they need to be, alleviating stress from patients and their families. His dedication and good nature, which are demonstrated in his absolute commitment to his work and passion, make him an excellent candidate for the Staff Recognition Award. Congratulations, Norm Conyer, on this long overdue award. You've definitely earned it.
Hello everyone. I am truly honored to receive the Staff Recognition Award. The Imaging Research Center has come a long way since I joined in 2004, and I gratefully accept this award in recognition of the hard work of many individuals over the years. I would like to acknowledge the support of the Research Institute's donors and grantors that made this award, and indeed all that we do in research, possible. While I am personally very grateful for this award, research is truly a team effort, and I have many to thank. From our MRI technologists, Julie, Carol, Shannon, and Cheryl, to our researchers whose support keeps the IRC a vibrant hub of activity. We collaborate with many researchers from across St. Joe's, from the Bohr Center to the Firestone Institute, to our partners from HHS and McMaster. The IRC is also a true collaboration between Diagnostic Services and Research St. Joe's, and I appreciate the support of the DS management team. I would like to thank Dr. Mike Noseworthy. Mike keeps things interesting, and the students constantly challenge me as they push the boundaries of what we can do with MRI. Finally, I want to thank my partner Bonnie and my kids Maeve and Sam for their love and support. Without them, none of this would have been possible. Thank you.
Well done, Sarah and Norm, recipients of the 2021 Research Institute Staff Recognition Award.
Now, before we move to the next award, Dr. Margaret McKinnon, lead for the Mental Health and Addictions Research Pillar, will share a brief update on what they've been up to this past year.
This past year, St. Joe's Mental Health and Addiction Research Pillar has continued its fast-paced growth. With the ongoing pandemic, our research teams have embraced remote work and continue to make huge strides in their fields. In February, the Center for Clinical Neuroscience was granted a MyTax Award for a 2-year project, which aims to identify patient subgroups and predict relapses in bipolar disorder. St. Joe's researchers were also the recipients of 2 New Frontiers in Research Fund exploration grants from CIHR. The first went to Dr. Flavio Kapinski for a project that will see the use of artificial intelligence and machine learning to predict suicide attempts in youth. The second of these grants went to Dr. Benicio Fry, whose work aims to end the trial and error paradigm in mood disorders treatment. In the spring, the Peter Boris Center for Addictions Research published multiple studies related to substance use, addiction, and COVID-19. Their work has revealed some unanticipated fallout from the pandemic. Our trauma researchers have been working closely with fellows in the newly created fellowship at our partner institution, Homewood Health Research Institute. This fellowship will advance research to help first responders and healthcare professionals living with post-traumatic stress injuries. And in spite of the pandemic, researchers still managed to host several conferences virtually. Our forensics program hosted the 14th annual Risk and Recovery Conference in April, and the Center for Medicinal Cannabis Research held its annual conference virtually in May. Our researchers are hard at work, enhancing our knowledge of mental health and addiction for the benefit of our community.
Thanks for that update, Dr. McKinnon. Glad to see the pandemic hasn't slowed down the mental health and addictions research pillar. It should come as no surprise to learn that many of our researchers had an early interest in science and academia. Here at the Research Institute of St. Joe's, we're happy to support those working to nurture our next generation of scientists. Since 2015, we've sponsored several awards at the Bay Area Science and Engineering Fair, or BASEF. And for 61 years, BASEF has given students the opportunity to showcase their projects and ideas and step into the world of science and engineering.
Our 2021 BASEF Student Award winners for the junior category are Nicholas Pacifici of St. Bernadette for his project entitled Head on a Swivel, Mimicking Concussion and Whiplash Mechanism of Injury, and Jasmine Karras of Oakville Christian School for her project entitled For This Valve, I Cannot Change.
And in the intermediate category, our 2021 Student Award winners are Yuna Lee and Nuyung Yong of Oakville Trafalgar High School for their project entitled Divulging into Schizophrenic Treatments, How Standardized Treatments Compare to the CRISPR-Cas9. And Evan Shvetsoff, also from Oakville Trafalgar High School, for his project entitled Has the COVID-19 Pandemic's Restrictions Affected the Anxiety of Adolescents? And finally, Anthony Saturnino of Bishop Ryan Secondary School for his project entitled AS 2021M Non-Medical Electronic COVID-19 Face Mask. Congratulations to all our BASEF winners.
Really incredible work. Year after year, the students at BASEF continue to amaze us, and I'm so glad that this great opportunity to promote science could continue despite the pandemic. Under St. Joe's 5-year strategic plan, which was launched in late 2019, research has been solidified as a main priority for the hospital. Under the strategic plan, research and academics fall under the domain of the learning pillar. This commitment from our executive leadership bolsters our status as an academic teaching hospital. In keeping with our mission of discovery, St. Joe's is educating the world's best researchers and clinicians.
Speaking of learning, it's time to announce this year's recipients of the Research Institute's Studentship Awards. The Research Institute supports the development of research expertise among our graduate and postgraduate learners. I'm pleased to announce that this year's Studentship Award has 2 winners. Congratulations to the recipients Jackie Trink and Lucas Gallo. Jackie Trink is a PhD student working under the supervision of Dr. Joan Krupinski. Jackie has received several high-caliber awards. Her innovative project will build on her previous findings involving protease inhibitor and its interactions with GRP78 and whether blocking these interactions might protect against diabetic kidney disease. Lucas Gallo is a master's student working under the supervision of Dr. Sophocles Voineskos. Lucas is conducting a pilot research project on closed incision negative pressure therapy following autologous abdominal tissue breast reconstruction. As a researcher, Lucas has a strong track record, and the timelines of his oncology-based projects are expected to be largely unaffected by the pandemic. Congratulations, Jackie and Lucas.
Hello, my name is Jackie Trink. Thank you so much for supporting my research through this award. In my current project in the Dr. Krupinski lab, we are working on developing a novel anti-fibrotic therapy for patients suffering from diabetic kidney disease.
Hello, My name is Dr. Lucas Gallo, and I'm a plastic surgery resident at McMaster University and currently enrolled in the Surgeon Scientist program for the Department of Health Research Methodology. I'd like to begin by offering my sincere thanks as the recipient of the 2021 Research Institute Studentship Award. This funding will help us to initiate a research study that will compare closed incision vacuum dressings to standard dressings that are applied to the abdomens of women who undergo breast reconstruction using their abdominal tissue after mastectomy. Given that approximately 10,000 breast reconstructions using this technique were performed in North America in 2019, this study has the potential to lead to a significant reduction in abdominal wound complications and can have an important impact in the quality of life for those women who choose to undergo this type of breast reconstruction after mastectomy and breast cancer diagnosis. Thank you very much, and we sincerely appreciate your support.
Let's move on to this year's Post-doctoral Fellowship Award. This award is intended to support the development of postdoctoral research fellows as independent researchers. The 2021 Postdoctoral Fellowship Award recipient is Yan Gu. Dr. Gu is a postdoctoral fellow working with Dr. Damu Tang under our Genitourinary Research pillar. She has an outstanding publication and patent record. Her research will characterize the course of membranous nephropathy, an autoimmune disease of the kidney, and study the underlying mechanisms and molecular pathways relevant to age and sex dimorphism. Dr. Gu has been working on a novel mouse model for studying this disease that has many advantages over existing models. Congratulations and best of luck on this incredible work.
Hi, my name is Jennifer and I am the recipient for the 2021 Postdoc Fellowship offered by St. Joe's. I am extremely honored and grateful to receive this award because not only it will help us to conduct the research we're trying to do, but also marks a big milestone for me as well in aspiring to be an independent researcher. So this fellowship will help fund a research that we're currently doing that is aimed at producing a novel transgenic animal model for a kidney disease known as membranous nephropathy. The knowledge we gain here will help us to advance our current understanding of the disease and help us to investigate the intricate mechanism underlying the disease etiology and progression. And hopefully this knowledge can be translated into the clinic in which we can hopefully to develop a more precise, more improved, and more targeted treatments for our patients in the future.
Hello, my name is Lahana Tabani, Vice President of Research at St. Joseph's Healthcare in Hamilton, and I'm also the Scientific Director of the Research Institute. I have been doing research in health sciences and clinical trials as a methodologist for many years, to be exact, over 20 years. And I'm thrilled to be in this new role as VP for Research and Scientific Director. As we look into the future, there are fast opportunities for us to really shift our collective approach to how we do research to the next level. For example, we are now aiming to build our next generation of researchers through establishing a formal mentorship program. We will also reinforce our areas of excellence, while we also build on in areas that require more support. We will continue to foster, of course, a culture of diversity, equity, and inclusion across all our aspects of operations within the Research Institute. I would like to congratulate all today's award recipients, and I would also like to thank awards committee members for volunteering their time and expertise in the review of each of the applications. Now, before we go to the next award, Dr. Martin Cove and Dr. Don Bodish are here to give us an update on our lungs and chest research pillar.
Under the banner of the lungs and chest pillar, researchers in respirology as well as thoracic surgery are helping Hamiltonians to breathe better. They're contributing to a body of knowledge that has truly a global impact. For over 40 years, the Firestone Institute for Respiratory Health has advanced our understanding in diseases like asthma, COPD, idiopathic pulmonary fibrosis, and many others.
Despite the challenges presented by COVID-19, the lungs and chest pillar has seen many recent publications in top respirology journals, including the Lancet Respiratory Medicine, the European Respiratory Journal, and the New England Journal of Medicine, to name a few. Our faculty have been recognized with various awards and grants. In the spring, Dr. Sarah Svenningsson was named the Canada Research Chair in Translational Pulmonary Imaging, And Dr. Nathan Hambley received the 2020 Career Development Award from the Department of Medicine, which will allow him to further develop his academic and research portfolio.
The COVID-19 Immunity Task Force has granted $500,000 to a Firestone research team led by Dr. Manali Mukherjee. Their project will study the immunology implications related to long COVID. Dr. Kieran Scallon has joined the Firestone Institute as an academic respirologist. He has a focus on interstitial lung disease and peri-lung transplant care. And finally, thanks to a transformational gift from the Boris family in 2019, the Firestone Institute for Respiratory Health has recruited a new executive director. In 2021, we were excited to announce that Dr. Dawn Bodish has been appointed to this leadership role.
I'm very excited to take on the role of executive director. I've been working with Dr. Kolb and other faculty members to develop a strategic plan for the Firestone. Ultimately, it will guide the next decade of respiratory research and innovation right here in the heart of Hamilton.
Thank you both for that great presentation. St. Joe's is so lucky to have Dr. Dawn Bodish joining us as the new Executive Director of the Firestone Institute for Respiratory Health. It's time we head over to Dr. James Douketis, who will announce the recipient of the 2021 Constantine Douketis New Researcher Award.
Hello, my name is Dr. Jim Douketis, and I'm a physician here at St. Joseph's Healthcare Hamilton. The Constantine Douketis New Research Award aims to provide young researchers who are at the beginning of their careers with an opportunity to pursue independent research. I'm very pleased to present the 2021 award to Dr. Kimberly Lewis. Non-invasive ventilation is a technique that can be used on select patients experiencing acute respiratory failure. Compared to other techniques, non-invasive ventilation is safer, preferred by patients, and can have better ICU outcomes. However, physicians currently lack recommendations on which sedatives, if any, to use in patients undergoing this type of procedure. One such sedative, called Dex, is seeing expanded clinical use and may be a suitable candidate. In order to design an international clinical trial studying the use of Dex in non-invasive ventilation, Dr. Lewis and her team are looking to first understand how physicians are currently using sedation for this procedure, if at all. Congratulations, Dr. Lewis, and best of luck with your research.
Hi everyone, my name is Kim Lewis. I'm an assistant professor at McMaster University and an intensivist at St. Joe's Healthcare Hamilton. I would like to thank the Research Institute of St. Joe's for awarding me the Constantine Douketis New Researcher Award for my project, Non-Invasive Ventilation, Dexmedetomidine in Critically Ill Adults, the INDEX Research Program. We know that acute respiratory failure is a common reason for admission to an ICU in Canada. Non-invasive ventilation is a life-saving intervention for select patients with respiratory failure. Unfortunately, not all patients tolerate non-invasive ventilation. If they're unable to tolerate non-invasive ventilation, intensivists usually have no choice but to intubate a patient. Therefore, with this grant, we're going to help determine if sedation can actually reduce the risk of non-invasive ventilation failure, prevent intubations, prevent prolonged ICU admissions, and reduce our resource utilization. Obviously, in this climate, the impact of that is enormous. And this is particularly important where all ICUs internationally and nationally are severely strained. So thank you very much.
Non-invasive ventilation is such an important research topic in critical care, especially in light of the pandemic. Congratulations, Dr. Lewis. Our next award was established in 2015. It provides seed funding for pilot projects that explore innovative approaches to address the hospital-to-home transition and support the community living needs of individuals and families living with schizophrenia, schizoaffective disorder, or related psychotic disorders and mood disorders. Please join me in welcoming Dr. Ian Rowe to present the Dr. Ian and Shirley Rowe Research Fund Award to explore innovative ways of managing psychosis in the community.
Hello, I'm Dr. Ian Rowe. I am pleased to present the Dr. Ian and Shirley Rowe Research Fund Award established to explore innovative ways of managing psychosis in the community. This year's recipient is Dr. Michelle Carostel, a clinician, scientist, and psychiatrist in the Cleghorn Early Intervention Program at St. Joseph's Healthcare, Hamilton, and an associate professor in the Department of Psychiatry and Behavioral Neurosciences of McMaster University. Her academic interests include developing psychosocial and adjunct treatment pathways for persons with psychotic disorders and severe and persistent mental illness, and using multimodal neuroimaging techniques to understand brain-body relationships in psychosis. Dr. Carostel's project is entitled Deconstructing the Insight Social Anxiety Paradox in Psychotic Disorders via Novel Psychotherapeutic Intervention, Addressing an Unmet Need. Studies show that individuals with psychotic disorders suffer from social anxiety at 5 times the rate of the general public. Dr. Carostel aims to characterize the multidimensional relationship between insight and social anxiety in early psychosis. It is hoped the findings will encourage clinicians to become more mindful of recognizing and properly treating social anxiety and patient insight changes along various dimensions. Congratulations! We look forward to hearing more about the results of your research.
Thank you very much to the Rowe family for their ongoing generous support of research at St. Joseph's Hospital. I am grateful to receive the Rowe Award this year in support of my research to better understand the complex and sometimes paradoxical relationship between insight and debilitating social anxiety in early psychosis, which is often associated with shame and self-stigma. These are aspects of psychotic disorders such as schizophrenia that are often under-recognized and undertreated. Our research will use a novel psychotherapeutic treatment to both better understand the relationship between insight and severe anxiety and to improve our treatments of this underappreciated source of suffering for many young adults with psychotic disorders.
Congratulations, Dr. Carostel, and thank you, Dr. Ian Rowe and Shirley Rowe, for your continued support of research at St. Joe's. It's now time to reflect on some recent achievements from our largest pillar, the Father Sean O'Sullivan Research Center, more commonly known as FSORC. Let's pass it over to Dr. Ann Holbrook, who is now the lead of the FSORC pillar.
Hello everyone, I'm Dr. Ann Holbrook, the new research pillar lead for FSORC. I'm also the Director of Clinical Pharmacology and Toxicology at the university and at the 2 hospital corporations. I'm also one of 3 researchers who transferred from the university to St. Joe's to establish a pharmacology, pharmacoepidemiology, and health technology assessment program led by Stuart McLeod in the very early 1990s. This predated FSORC and the Research Institute, but persists as an evaluation of medicine's research group. We all owe Stuart, a former Dean of Health Sciences at McMaster, a debt of gratitude for his vision, his positivity, and his collaborative nature. As you know, the other research pillars at St. Joe's focus on specific organs, lung and chest, kidneys and urinary tract, brain and mental health. FSORC houses everything else, every other specialty and topic, and includes leaders of a wide range of lab science, clinical and evaluative research. FSORC is also the largest of the 5 research pillars at St. Joe's, accounting for over 180 research faculty, of which more than a dozen are highly productive principal investigators who drive the success of the pillar and account for over 60% of the publications known to the Research Institute this year. At least 3 members also hold Canada Research Chairs. These would be Drs. Cook, Devereaux, and Coe, and congratulations to them. This pillar is comprised of many well-established research programs, including anesthesia, biostats, clinical epidemiology, clinical pharmacology, cardiology, critical care, nutrition, rheumatology, virology, and others. FSORC also holds much of the research methodology expertise that supports our colleagues in the other pillars, expertise that's critically important to the success of our research grants. FSORC also continues to foster growth into new research fields at St. Joe's. For example, research capacity in obstetrics and gynecology has been steadily growing in recent years, an area obviously integral to the mission of the hospital. In addition, we are just about to make significant gains in research data analytics. Many of you may not be aware that St. Joe's was the first adult academic hospital in Canada to adopt the international leader in electronic medical records called Dovetail Epic. Those of us who are clinicians are well aware of the changes and advances in quality and safety of care for our patients that ensued. But in addition, we've made big research strides with EPIC as well. We've just submitted the first large CIHR grant application that will use the quality data infrastructure of EPIC and its 60 million patient worldwide network to address a major patient safety problem. Now I'd like to highlight just a few of the major FSORC achievements and recognitions over this past year. You may already know that St. Joe's Virology Lab is widely regarded as a state-of-the-art internationally. However, since January of 2020, St. Joe's Disease Diagnostics and Development, which is the D3 group, has made key contributions to COVID-19 mass testing and evaluation. This group rapidly ramped up to 24/7 testing using innovation in test materials and much faster testing throughput using rigorous diagnostic testing validation methods. It's difficult to understate the critical importance of this innovation, which basically kept us afloat as hospitals open for business during the huge waves of patients with COVID. This and their wider pandemic studies, including the Toronto Airport study, the Shelter Network study, etc., continue to lead to unprecedented external investment and partnership in the new lab infrastructure. As well, Dr. Andrew Costa and his team have published their findings on the size, location, and key factors involved in COVID-19 outbreaks in Ontario's retirement and long-term care homes. Dr. Costa and a new geriatrics clinician scientist, Dr. Justin Lee, will be integral in the development of St. Joe's research data analytics infrastructure. 3 FSORC researchers joined the Canadian Academy of Health Sciences as fellows this year: Dr. Jim Douketis, Dr. Lahana Tabani, and Dr. Mitch Levine. Dr. Deb Cook was awarded the Lifetime Achievement Award from the Society of Critical Care Medicine. Dr. Rick Adachi is this year's winner of the Department of Medicine's Jack Hirsch Award. As well, we welcome Dr. Kimberly Lewis and Dr. Emily Bellicote as assistant professors in the Division of Critical Care. They join Drs. Cook, Walid Elhazani, and Michelle Coe and others in cutting-edge, highly successful critical care research, including national clinical trials and guidelines. We all as a society also continue to benefit from the ongoing research of our cardiology, rheumatology, anesthesia, and surgical colleagues. As for the future, our goals include increasing awareness of our world-class research programs, providing further opportunities for interdisciplinary collaboration, and expanding our use of data analytics with Dovetail to further inform high-quality research. As a research institute, we have embarked on a renaissance in leadership which will also focus on improving and streamlining research infrastructure. This is vital in the increasingly competitive, complex, and regulated world of research. Please wish us well in all of our endeavors.
Hello everyone, I'm Melissa Farrell, President of St. Joseph's Healthcare Hamilton. Thank you for joining us as we celebrate research. St. Joe's is an academic health science center within an integrated health system. We're affiliated with the world-renowned McMaster University, where life-changing research and innovation benefits patients, where we educate the world's best and create a healthier community. We made learning one of the key pillars of our 5-year strategic plan, which launched in 2019, and we're refreshing the plan to reflect the new environment brought on by the COVID-19 pandemic. Our goals are to strengthen our research leadership, particularly in the areas of mental health and addiction, kidney and urinary, respirology, and integrated comprehensive care. We will work to continue advancing internationally recognized research that is driven by our principles of mission-centered care to influence healthcare while providing an outstanding educational experience for our learners. And we have worked with our academic partners, McMaster University and Mohawk College, to strengthen our collaborative efforts. I'm a firm believer that we can accomplish much more together than we can on our own. Fittingly, our next award supports interdisciplinary collaboration at St. Joe's. To announce the recipients of the St. Joseph's Healthcare Foundation Collaboration Grant, we are joined by Foundation President Sarah Felice Armenio.
Hi, I'm Sarah Felice Armenio, President of St. Joseph's Healthcare Foundation. One of our foundation's priorities is to raise funds in support of groundbreaking research that changes lives. By bringing the vision of our researchers to our community of donors, we can inspire them to be a part of making a difference in the future of healthcare. St. Joseph's Healthcare Foundation's Collaboration Grant celebrates collaboration between research programs within the Research Institute of St. Joe's Hamilton. I am honored to announce the recipients of this year's grant. The winners are Dr. Dan Perry as lead investigator, with co-applicants Dr. Manali Mukherjee, Dr. Lawrence Boisbar, Dr. David Bueller, and Dr. Waleed Al-Hazani. This interdisciplinary team is working together on the project titled Variability of Autoinflammatory Markers as Predictors of Severity, Mortality, and Chronicity of Severe Mechanically Ventilated COVID-19 Patients in the Intensive Care Unit. The recipients of this award aim to develop a method to accurately predict COVID-19 prognosis and clinical course. The knowledge of risk related to complications or chronicity can help patients, their families, and the health system plan for the future of COVID patients. As we move forward, this research is vital in combating COVID-19 and virus variants. Congratulations to this year's winners, and best of luck with your research.
I'd like to thank the Research Institute and St. Joseph's Healthcare Foundation for the collaboration grant. Through this grant, we will put together researchers from intensive care medicine, respiratory medicine, immunology, virology, and statistics to try and figure out why it is that some patients who get COVID have worse symptoms or worse outcomes than others. We aim to, through this research, identify patients who have immune markers that might impact whether or not they end up having significant ICU needs or complications like blood clots or MIs. We also hope that we can develop a predictive tool to see if we can potentially avoid even getting to the ICU by identifying patients who have significant immune risk earlier. This is all possible through this grant. Thank you.
Kidney research is one of our 5 pillars here at the Research Institute. From basic science to transplants, molecular research to dialysis, the kidney program is working to improve care and develop new treatments for a variety of conditions. Dr. Richard Austin, research lead for the kidney program, is here to share some of the exciting news and research stories from this past year.
The kidney research pillar at St. Joe's conducts clinical and laboratory studies related to nephrology, kidney transplantation, and cardiorenal diseases like hypertension and diabetes. Within the kidney research pillar, the Hamilton Centre for Kidney Research has furthered its contract with Amgen Canada. This will provide an additional $333,000 per year for 3 years of research in cardiorenal diseases, including diabetic nephropathy, vascular calcification, and acute kidney injury. Dr. Joan Krupinski is a clinician scientist who has received a grant from the Kidney Foundation of Canada to investigate the role of a gene called LASP1 in the development of diabetic nephropathy. Dr. Matt Langtree is a clinical geneticist interested in the underlying genes that, when mutated, contribute to chronic kidney disease. A 5-year study on genetic variants and chronic kidney disease conducted by Dr. Langtree is being supported by over $600,000 in CIHR funding. And Dr. Paul LeBeau and myself are continuing our studies on genetic variants of the PCSK9 gene that may protect against multiple human diseases such as liver and kidney disease. We recently received a 5-year CHR grant to study this extremely rare variant that provides good health and longevity in individuals harboring this variant. Working with a company called Atomwise, Dr. Jeffrey Dickout and I will develop and identify novel small molecules that could have applications in the treatment of acute kidney injury and associated cardiovascular complications. We also have an additional collaboration with Atomwise to identify small molecules that block or inhibit the development of vascular calcification, a major contributor to cardiovascular disease observed in CKD patients on dialysis. And despite the pandemic, we continue to grow as a research group. Our program has recruited 8 new graduate students who have begun their studies in the labs of Dr. Krupinski, Dr. Dickout, and myself. Looking ahead, the Hamilton Centre for Kidney Research continues to seek additional funding through CIHR and other agencies, and many of its discoveries are being patented and assessed for commercialization. The center is also looking to identify an early career researcher to become a team member within St. Joe's Kidney Research Program and contribute to our steady growth. We are extremely excited about our research program and its direct impact to the treatment of patients with chronic kidney disease and its associated cardiovascular complications.
Our city has come a long way from its roots as a steel town. We've also become a major center for post-secondary education and health sciences, with a thriving art scene and a highly collaborative healthcare network. In fact, despite the havoc wrought by the pandemic, it highlighted the important connections that exist between St. Joe's researchers, clinicians, and our partners in healthcare at Hamilton Health Sciences and Niagara Health. In previous years, we've hosted many of our regional partners at Celebrate Research. We look forward to the time when we can safely meet again, exchange ideas, and launch new collaborations. Visit our website, research.stjoes.ca, to learn more about our community partners.
Our affiliation with the Faculty of Health Sciences at the world-renowned McMaster University has consistently been a major advantage to our hospital, attracting the brightest researchers and students. McMaster's Industry Liaison Office remains an excellent resource to bring new scientific discoveries and developments to market faster by streamlining the patent process and connecting researchers with commercial entities. And industry partners like Clinical Trials Ontario continue to provide valuable guidance for clinical researchers. Over the last year, many St. Joe's researchers have been part of multi-center international trials related to COVID-19 treatments. Some have even launched their own multi-center trials with support of the Canadian Institutes of Health Research.
St. Joe's D3 group has played a tremendous role in our efforts to fight the pandemic. Researchers there created a robust clinical test for the virus, solved province-wide testing supply shortages, and bolstered our ability to perform mass testing, which was so crucial during each successive wave of the pandemic. By partnering with the local health sciences firm Bay Area Health Trust, the D3 group licensed their new molecular medium for research distribution. The work of the D3 group could not have been done without the support of the Juravinsky Research Institute, the Government of Ontario, and the Research Institute of St. Joe's. You can all learn about our clinical and laboratory pandemic research in our annual report. Check out stjoes.ca/report for this and much more.
It's now time for the Forensic Psychiatry Awards, which are supported by the Forensic Psychiatry program at St. Joe's in partnership with the Department of Psychiatry and Behavioral Neurosciences at McMaster University.
Let's check in with Dr. Gary Shamowitz, who will announce the winners of this year's Forensic Psychiatry Awards, including the inaugural Joe K. Award.
Hello, my name is Gary Shamowitz and I'm the Head of Service of the Forensic Psychiatry Program here at St. Joseph's Healthcare in Hamilton. Today I'm pleased to announce the Forensic Psychiatry Awards. The Forensic Psychiatry Research Award goes to Casey Upfold. Casey is conducting a cross-sectional study to assess the frequencies and characteristics of sexual behaviors and fantasies in the general population using an online survey. Existing research in this area has focused on clinical and correctional populations, which means it's likely not representative of the general population. This project will afford researchers the ability to make meaningful comparisons against general prevalence rates. Congratulations, Casey. And now the Forensic Psychiatry Research Award for trainees. This award goes to Emma Marston. Emma is utilizing a cross-sectional study designed to explore functional connectivity across dimensions of antisocial personality traits in heavy drinking individuals. Alcohol use disorder is highly comorbid with other psychiatric disorders, namely antisocial personality disorder. Emma will work with functional MRI to illuminate abnormal patterns of brain activity in patients with this specific comorbidity. Congratulations, Emma.
Hi, I'm Casey and I work in the Forensic Psychiatry Research Unit. I am so grateful to have received this year's Forensic Psychiatry Research Award for our project on typical and atypical sexual interests and behaviors in the general population. With the help of this funding, we'll be able to essentially provide clinicians and knowledge users with base rates for them to make comparisons against. And we also think that this research will add to existing literature, but also further future research in sexual health as well as sexual offending. So again, I'd just like to express my sincere gratitude for the support of this project through the Forensic Psychiatry Research Award.
I want to say thank you very much for supporting my research through the Forensic Psychiatry Research Award for trainees. This award will be used to study brain activity in individuals with alcohol use disorder and antisocial personality disorder, allowing us to identify potentially abnormal patterns of brain activity, which may provide novel targets for clinical interventions.
The Joe Kovacic Award is an award to honor a social worker who worked for 50 years in this program. Joe Kovacic was a fundamental figure in the development and growth of the forensic psychiatry program. He is well known to many people. He modestly agreed to the award as long as we called it the Joe K Award, not the Joe Kovacic Award. And now for the inaugural Joe K Award in forensic psychiatry. This award provides funding to support research projects devoted to the advancement of forensic mental health research. This award is new to our awards lineup and supports new researchers working to establish a strong research program, increasing their competitiveness for further external funding. The 2021 Joe K Award in Forensic Psychiatry, the recipient this year is Dr. Heather Molden. Dr. Molden is conducting a comprehensive evaluation of the implementation of the SAPROF in a Canadian forensic mental health service. The SAPROF is a tool for assessing and managing risk of violence in adult forensic psychiatry patients. Unlike other tools, it also examines protective factors, which may increase its accuracy and reliability beyond other tools that use risk factors alone. Importantly, Dr. Molden's project will help validate this tool for more widespread use, with the goal of facilitating more balanced and accurate risk assessments. Congratulations, Dr. Molden.
Hello, my name is Heather Molden, and I'm so grateful to have received the Joe K Award in Forensic Psychiatry. This award is particularly special to me because of the wonderful man and consummate forensic professional after which it was named. Thank you so much for supporting my research, looking at incorporating protective factors into the risk management of individuals in the forensic psychiatry program, which we hope will improve violence prediction and prevention.
Thank you, Dr. Shamowitz, and congratulations to our Forensic Psychiatry Award winners. Next, we're joined by Dr. Anil Kapoor, Research Lead of the Genitourinary Research Program, who will give us an exciting update about their amazing work this past year.
Working at the intersection of laboratory science and clinical care, St. Joe's has become a leader in genitourinary research, diagnostics, and treatments. Our research team includes a variety of specialties working synergistically: urology, oncology, genetics, pathology, palliative care, and more. The genitourinary pillar was launched in 2018 following two transformational gifts from John Ribson and Jim Bullock. These gifts led to the creation of the pillar's flagship research center, the Urological Cancer Center for Research and Innovation, otherwise known as the UCCRI. Over the past year, the UCCRI informative patient outreach sessions, which were once hosted at the hospital, have continued through a virtual platform due to this pandemic. In April, Dr. Bobby Shagan, Dr. Eddie Matsumoto, and I hosted an informative virtual session on prostate cancer. We shared information on screening methods, surgical techniques, including robotic techniques, treatments, and the latest research with our online audience of patients and caregivers. Our laboratory scientists have been busy filing several patents to bring new discoveries to market. Dr. Dan Tang is in the process of patenting a new diagnostic multi-gene panel for papillary renal cell carcinoma. And the UCCRI is working with academic and industry partners towards a future of urologic medicine with over 24 new and ongoing clinical trials. Several manuscripts are making their way towards publication, many of which are collaborative projects that involve learners from various levels: medical students, urology residents, and fellows. Looking towards the future, the genitourinary program has recently selected a candidate for a new fellowship focused on cancer prevention. And as we continue towards expanding the UCCRI website and its patient resources, including kidney, bladder, and prostate information portals, our goal is to keep patients and their families well informed of the latest innovations in urology so they can make the best decisions for their care.
The McArthur Research Award is granted annually to an internationally recognized researcher at St. Joe's. This year, we'll be announcing the winner of the 2021 McArthur Research Award on our website and our social media. So be sure to follow us on Twitter and Instagram to be the first to hear the news.
With the shift to virtual events last year, we were able to host the traditional McArthur academic presentation as a separate event. This allowed for a more fulsome presentation by the award winner and more engagement from our audience. And we're planning to do the same this year. When we announce the McArthur Award recipient, we'll also share the details for the academic presentation.
Last year's presentation by our 2020 winner, Dr. Lahana Tabani, drew a large audience, and you can watch that again anytime at research.stjoes.ca/celebrate. Just click 2020 in the sidebar.
Well, Laura, that about wraps things up for Celebrate Research 2021.
But we're still celebrating research all month long. Keep an eye on our social media for a series of elevator pitches by our award recipients. And as we just mentioned, the McArthur Award winner and academic presentation date will be announced in the coming weeks.
On behalf of everyone on our research administration team, congratulations to all our 2021 award recipients. We can't wait to see your projects come to fruition.
We hope you had fun watching today's virtual ceremony. Make sure to register for our quarterly research newsletter, Innovator, so that you can stay up to date with some of the most impactful research stories at St. Joe's. Visit our website and click Stay in Touch.
Thank you to our foundation and our donors for their continued support of research at St. Joe's. You make it possible for many of our researchers to do the critical work they do year after year with your philanthropy.
Thank you to everyone who joined us today and for supporting research that changes lives. It means the world that we have such a supportive community. To our researchers, students, staff, clinical partners, and local collaborators, thank you for being part of this event.
Thank you, everybody, and take care.